Hi, I'm Kim Madden. I'm an assistant professor at McMaster University in the departments of Health Research, Methods, Evidence, and Impact, and the Department of Surgery. I'm also affiliated with the Center for Medicinal Cannabis Research, and I'm the research director of orthopedics at St. Joe's in Hamilton. So my overall research program for the past 5 to 7 years has focused on pain management, primarily in orthopedics and joint replacement surgery. And mostly we focus on minimizing opioid overuse. So in orthopedics, we recognize that we have an over-reliance on opioids for pain management, and opioids can have an unfavorable risk-benefit ratio. However, they're still used as the first line in pain management in orthopedics pretty much ubiquitously. So there has recently been a focus on multimodal and alternative pain management strategies, and particularly on personalizing treatment options based on patients' values and preferences. So there's been a lot of anecdotal evidence that cannabis can reduce pain, inflammation, and possibly the reliance on opioids. We did a survey a little while ago that showed that around 30 to 40% of orthopedics patients had used cannabis for pain. And this was around the time of legalization. So they were mostly using it informally, but some through medical cannabis programs. However, it hasn't really been studied in high quality trials. So for most drugs that you use for medical purposes, they have to go through a very rigorous testing procedure, and we do randomized trials on them. But this hasn't been done with cannabis, even though it's legal to sell it. So that really interests me, figuring out whether it actually works, even though people are using it in this manner. I've been working with Dr. Jason Bussa at the Center for Medicinal Cannabis Research and Dr. Anthony Adili at St. Joe's on a randomized trial on oral cannabis. So we have a CBD dominant oil that we're giving to patients who are undergoing total knee replacement surgery. It's a pretty painful surgery. About 20% of people have lasting pain after surgery, and really our only option right now is opioids. But again, we're relying too heavily on these opioids. So we want some sort of alternative. And we think that cannabis can be a safer, effective alternative or adjuvant to opioids and give patients another option. So we are doing a randomized trial on that, and we're doing it at 2 sites, one in Hamilton and one in Toronto. And we are well on our way to completing enrollment for that, and we'll have results in about 6 months. We do have some future research that we're planning. So we are working with a local company who has developed a topical patch for cannabis. It's mostly CBD dominant. And we plan on testing it on patients who have had shoulder surgery or are about to have shoulder surgery, because we think that having the cannabis applied locally can have even fewer side effects than if you take it by mouth or inhaled. So we're hoping that that is also going to be a safe and effective option for pain management for patients in the future.